I'm Anita Hazari. I'm a consultant plastic surgeon and my peripheral patch is East Kent. So as a result of that, I operate at One Ashford Hospital and see my private patients here. So women come to see me for breast reduction surgery because if they have large breasts, they find they're very heavy, give rise to strap indentations in the shoulders, can have neck ache, backache, getting really hot and sweaty underneath the breast in the summer months, which can give rise to intertrigo, which is redness and sometimes a fungal infection. So to try and get the weight off, women would like to then have a breast reduction operation. What breast reduction does is makes the breasts smaller so they're in keeping with the rest of the body shape and takes the weight off. So therefore, patients, the first thing they say the day after the surgery is, I don't have backache, I don't have neck ache anymore. The grooves in the shoulders do take a while to improve, but the main thing is that there's no pain anymore. Weight is relevant because there's no point having the operation if you're then planning to use that as an incentive to then lose weight, because I will make the breasts smaller in keeping with the rest of the body shape and they'll be years younger, so they'll be quite north, as I call them. And then if you then lose weight after that, they will go a little bit saggier. So it sort of negates the effect of the surgery. So what I advise my ladies is that it's a good idea to lose weight, get to the optimum weight you are likely to be, and then have the operation at that point. Most women, that's including me, we're always chasing something which is not achievable, which is trying to be a weight which we probably were before pregnancies and things. And I think it's very important to be realistic in what is achievable. There's no point trying to keep that size 8 dress at the back of the wardrobe thinking you're going to get into it. It's not going to happen. So just be realistic, try and achieve the weight you want, and then have the surgery. In terms of smoking, with this operation, I do move the nipple. The nipple is still attached to the breast tissue, but I have to move it north so that it's pointing forwards rather than pointing to the floor. So if someone's a smoker, one of the big things that happens in the body is there is reduced blood supply to the nipple. So when I have moved it up or north, there is reduced blood supply to the nipple, and that can jeopardize the nipple itself. So one can undergo what's known as nipple necrosis, which is basically the nipple and the areola becoming black, dying basically, and falling off. I compare a breast reduction operation the same as dressmaking. And my ladies will find that on the day of the operation I do lots of lines and measurements, and it's literally like making a dress. And the pattern, I think, from what I have been told, is it's similar to a bra pattern from several years ago. So what I do is I isolate the nipple areola complex, or the nipple with the surrounding areola, on a tongue of breast tissue, so it's still attached to the breast tissue. The blood supply comes through this tongue, and we call it, in medical terms, a pedicle. So you've got the nipple attached to the pedicle of the breast tissue. And then basically where it's coming down like that, I swivel it north, so I rotate it, so it's in the position where I want it to be. That's how it works. And then the lower part of the breast tissue is taken away, sent off to be looked under the microscope just to make sure there's nothing nasty in it. And then I suture everything with dissolving stitches, so there's no stitches to come out. Patients usually will have a drain overnight, so if there's any blood collecting in the breast overnight, that all comes out in the drain. And then I put the lady into a bra, she goes home, and I see her the following week. I say to my ladies who have breast reduction surgery, the one definite thing they will have is they will lose sensation in the nipples. Most women with large breasts have very variable sensation anyway, and there's no such thing as normal sensation. But whatever sensation they have, whatever is present after 6 months after surgery, that's what they'll end up with. There are, of course, the other sequelae following any operation, which is scars, which take several months to fade, sometimes up to 18 months to 2 years to fade, a possibility of bleeding, infection, bruising, swelling, and that's normal after any operation. Another issue which I have to highlight as well is that most women will have a slight asymmetry in the breast. So when you wear a bra, one side might be a little bit fuller compared to the other side. And to be very honest, in the 25 years I've been doing this, I've never seen a perfect looking pair. So I say to all my ladies again, after the operation, I'll try and even you up as much as I can, but I can only promise you very, very close sisters. I can't promise you identical twins. For most women who are reasonably healthy, I would expect 2 weeks. So for 2 weeks, no driving, no lifting heavy things, no hoovering or cleaning the bathroom or carrying cases. But after 2 weeks, you can certainly start doing things about the house, but be very careful about lifting heavy stuff. In terms of exercise, anything that involves bouncing movements, such as running, jogging, trampolining, I suggest not really to do that until everything's scarred down for about 8 to 12 weeks, because remember that I've taken the breast tissue off the chest wall, I have remolded it on the inside, so I want it to stick down nicely rather than it gravitating south quickly because of bouncing movements. At One Ashford, I do offer a small 15-minute free consultation. So if you feel you've got large breasts which give rise to problems such as neck ache, backache, or you wish to go a bit smaller so you can find clothes that fit, then by all means make an appointment to see me. I'm happy to see you and give you my opinion as to whether it's worth it for you to go through the operation or not.